nutritional program is divided into a cyclical program to make it more effective. Nutrition also in the body act like hormones. Today studies say that vitamin D, vitamin C, vitamin E, the effects and the action on various systems could be compared to effects of a hormone. We are extremely cautious that hypervitaminosis is common. Just because little bit of vitamin is good, excess vitamin does not act better, especially for hair growth cycles. And this needs to be taken as a care program for a very long time. To help our patients to follow the program for a long time, we have reduced the dosage and divided the dose into a 3-day cycle. The program consists of 2 applications. One is stimulating the hair to come in the growth phase. Second is creating a toxin-free environment favorable for the hair growth and supporting the cell division and growth of these cells. So bringing the cells in the growth phase, creating an environment free of toxins which helps the hair to grow by using antioxidants, and using nutrients, iron, calcium, zinc, magnesium, B complex, biotin, amino acids that form the structure of the hair is the basis of the program. There are 6 different vitamins in one kit, but we do not want 6 to be taken together, they go waste. So to improve the efficiency and reduce the dosage of the individual vitamins, we have these vitamins to be taken in a 3-day cycle. But you have a combination of 6 different vitamins and 4 different combinations for men and 4 such different combinations for women. Since we are not targeting the cause for the hair loss, but we are inducing better hair growth. So irrespective of the cause, the program doesn't work according to cause as we do in general for any other disease. We have a trend or we have a mindset of fighting everything as a disease. Hair loss is not a disease condition. Hair loss is slowing down of the biological cycles. We are creating the outcome or the benefit by supporting better growth of the biological cycles. That is the reason this will work irrespective of the cause. In hair loss, which is grade 1, 2, 3 and 4, we have patients who have grown 156% more hair than what they had within 6 to 8 months of starting the program. In higher grades of hair loss, however, the benefit will be restricted to 25 to 30% more hair, and the hair only in areas where there is existing hair growth. All patients who start the cyclical program will start seeing 20 to 30% improvement in hair growth beginning at 2 months on the program, and maximum effect is achieved between 6 to 8 months. When you are using the nutrition program, patients who have got gastric irritability are going to feel queasy or nauseating in the stomach if they use the vitamins on empty stomach, especially because our vitamins also contain some very active Ayurvedic proven herbals along with the vitamins. So they have to be careful not to take the vitamins on empty stomach. If they are good breakfast eaters, patient must take the vitamins after a healthy breakfast. Otherwise, take the vitamin after lunch or after dinner. They can also break up the 2 vitamins by taking one after lunch, one after dinner, or one after breakfast, one after dinner to reduce the irritation and make it acceptable. So because we have a care program that maintains the growth and quality of the hair, if the patient discontinues the program, he will not see deterioration in the hair for up to 2.5 to 3 months of stopping the program. 2.5 to 3 months later, we expect the program to start causing fresh hair loss. That is the time when the next hair growth cycle is about to be completed. So if you stop the program in this present cycle, you see the hair fall or the bad effects in the next cycle. You can always use finasteride along with the cyclical vitamin program. Finasteride will help to prevent the damage being done by DHT, but damage being done by DHT to the hair follicles is not the only mechanism of hair loss. It is one of the mechanisms by which you could be losing hair. The other mechanisms are to be corrected by creating a toxin-free environment for the follicles and providing for the structural growth of the follicles. The latest studies now also show that TGF beta secretion from the hair cells, which is responsible for apoptosis and miniaturization, is mediated through ROS or reactive oxygen species. Accumulation of free radicals is causing the TGF beta action. So correction of or neutralizing the action of these free radicals is extremely important in addition to blocking the enzyme. Using finasteride along with the program is an open option. You can always use finasteride with the program. Despite taking calcium every day, in the therapy calcium comes only twice in a week. This can still be taken, or you can select to not use the iron or calcium in the therapy, replace it with some other vitamin combination. But if the therapy continues and you take 2 doses of calcium or iron in excess to what you are already taking 7 times a week, it is not going to make a much change in a person who actually has deficiency or proven deficiency of iron and calcium. The therapies for proven deficiency for iron and calcium will go on for about 3 to 4 months. After they complete the therapy, a maintenance therapy on the kit where they use iron and calcium only twice a week would be well indicated. We need to explain the 2 parts of the therapy to the patient. One part is pushing the hair to come in the growth phase. Second part is providing a toxin-free environment and promoting the growth. Once the patients understand that these 2 are dependent on each other, they would definitely like to follow. We need to convince the patient to follow this in a better manner. You can surely combine the cyclical vitamin therapy along with any other therapy that you use for hair growth. It will enhance the results of all these therapies. In my personal practice, every patient coming for hair transplant, we need to understand the outcome or the result of the transplant will depend on the quality of the raw material you select for the transplant. If the patient is losing hair for past a year, 2 years or more and comes for transplant, his hair is become thin, weak and slow growing. Thin, weak, slow growing hair taken for transplant will not result in a healthy regrowth of the transplanted hair. So every patient at least for 2 to 4 months is on the cyclical vitamin therapy before the transplant to improve the quality and strength of the roots. We have seen that the number of roots we can harvest after this priming program or the preconditioning program is more. The quality of the roots is better. The roots are robust. They can be harvested and handled better, and following the same program after the transplant ensures a good growth. Laser therapy was discovered by Miester in 1967 when he was trying to study the effects of laser light on the back of shaved mice. He found that the mice that were exposed to half a watt of laser energy were growing the hair faster. So this laser therapy you can compare to photosynthesis in the plants being stimulated by exposure to sunlight, or standing in good sunlight so that the skin can create vitamin D. This is an inbuilt ability in our body. The endoplasmic reticulum in the mitochondria is responsive to light. So whatever sleeping or dormant cells in the scalp are stimulated by exposure to a particular frequency of light. Today we know the frequency of light required to stimulate the sleeping or dormant hair follicles. These hair follicles which are not performing, they are not in growth phase or fall phase, can be re-recruited into the growth phase by exposure to laser light. For every hair growth cycle, you have a fixed percentage of follicles that go in fall phase and you have a small fixed percentage from this that go in a sleeping or a dormant phase. The applications and vitamins we use will not work on the dormant follicles. If you have an additional laser therapy once a week, then the dormant follicles are recruited back in the growth phase and the application vitamins will become effective on these as well. So you get an additional bonus effect of 20 to 30% more. You can have 20 to 30% more hair growth than the regular program if you add laser for 20 minutes just once a week. Gradually, if you do not use the laser, follicles that go in the sleeping or dormant phase will become dead. They are no more functional and you lose them permanently. We measure light in terms of watts. The laser, so we say a bulb is 40 watts, 100 watts or 60 watts. The laser is only half a watt. The night lamp in your bedroom is 1 watt. So using half a watt of energy on the scalp for 20 minutes once or twice a week definitely does not have any side effects. This has been studied by US FDA and the laser device is a US FDA approved device to be free of side effects. It can be used as long as you like. You are being exposed to more severe light from many other sources as compared to this particular frequency given by the laser. So the phototherapy should not be feared at all. In general, in slang, it is called as a hair growth laser. In fact, this is just phototherapy with a light that is half a watt in strength. Laser can be used also for better wound healing. So you could use the laser within 3 to 4 days after the transplant so that the wounds heal better and the scabs will fall off earlier. When we use the cyclical vitamin therapy before and after the transplant, 5 days prior to the transplant, we need to discontinue the therapy because the vitamins cause improved blood flow to the hair roots and it might lead to a drop or two of additional oozing during the procedure. So 5 days prior to the hair transplant, you discontinue application of minoxidil and use of vitamins. This all can restart 10 days after the hair transplant. All the 4 variations for male and all the 4 variations for female are capable of giving you hair growth. You can start from any kit you like. The variation is to keep the patient busy and the variation is to make sure that the patient follow up with you for the therapy for entire 4 months. There is definite benefit in using a daily shampoo. This shampoo must be pH balanced. This shampoo must work in hard water as well as soft water. And this shampoo must be usable on colored hair. It's an additional benefit if this shampoo also acts as an anti-pollution shampoo. Keeping the scalp clean and hygienic is a part of growing it better. So daily scalp care today with the level of pollution that we have is definitely an boon and advantage to hair growth. Minoxidil is best started as 2%. If required, it could change to a slightly higher concentration of 5%. We strongly believe anything higher than 5% does not have an indication. And minoxidil, when used in patients who have signs of androgen excess, can be a choice to use minoxidil with finasteride. Locally acting finasteride 0.01% in the minoxidil gives excellent results in postmenopausal females and in young boys who are having signs of androgen excess. Yes, patients can benefit only using tripeptide application, but it's to be done 2 times a day. Once in the morning after bath, once in the evening before sleep. There is no compulsion that minoxidil has to be used.